Hello, I'm Dr. Nader Attalla, an addiction medicine specialist practicing in Canada. Today we are talking about what is addiction. "99% of people have misconception and misinformation and misunderstanding about addiction. Some people believe addiction is a choice. This is the first and the biggest misconception about addiction. These people who have addictions, they are just bad people who are doing bad things, or they are just people who are making poor choices. And these are just individuals with low moral standard because addiction is a sign of weakness and sign of selfishness and sign of narcissism. And this is based on that addiction is a choice. And this is not true. Another misconception about addiction, that drugs is causing addiction. Okay, so people who have addiction, they start using drugs, and because of their using drugs, they get addicted to it, and then they get intoxicated, and then when they stop, they get withdrawal symptoms, and because they cannot handle the withdrawal symptom, they keep doing the drug. This is another misconception. Okay, addiction is not a choice. Addiction is not caused by drug, but according to the American Society of Addiction Medicine, addiction is just a brain disease. What are the characteristics of this brain disease? Patients who have this brain disease, they're gonna start seeking reward, relief, or escape. Again, reward, relief, or escape because of this brain disease. And this reward or relief or escape could be through addictive drugs like heroin, cocaine, nicotine, or whatever addictive drug, or could be behaviors like sex, sports, addiction to social media, addiction to shopping, and any other addictive behavior. So again, it is seeking reward, relief, or escape. And then people ask me why they are seeking reward or relief or escape. Because they have a chronic feeling inside of unhappiness and discontent. Some people, they call it, oh, I have a void inside my heart. Or some people with addictions, they call, I have emptiness inside my heart. It is like chronic unhappiness. This negative feeling, why they have it? I told you because it is a brain disease. Okay, chemically, what is the problem? They have low dopamine. We call it low dopamine tone. When people have low dopamine, they feel dissatisfied, they feel discontent. But why they have this low dopamine? 40-60% of the problem is genetic. They are just born like this. And 40% because of the stress in life. It lowers your dopamine level. Another thing American Society of Addiction Medicine put is addiction as a primary disease. Primary means it is spontaneous. Like it is like primary headache. When you have primary headache, you have headache. It doesn't have to be something. Yeah, there is secondary headache, but I'm talking about primary headache. There is just headache. It's the same with addiction. 60% you are born there like this. 40% of the problem is some stressors happen in life. Put your dopamine low. When dopamine is low, you are seeking reward, relief, or escape. So basically, you're gonna be scanning the environment around you to find something to make you happy, to bring the dopamine up. Another thing about addiction is it is a chronic disease. Chronic disease means once an addict, always an addict. I'm not saying there is no treatment. I'm not saying there is no management. There is some techniques you're gonna learn with therapy and group therapy and some medication that can help with this disease too. But in general, you will continue to have this problem, but you need to learn some skills how to cope with it and how to manage it. Again, to summarize what is addiction: seeking reward, relief, or escape. You're gonna continue scanning the environment around you to find something make you happy. Once you find it, you're gonna keep doing it. Okay. American Society of Addiction Medicine, they put certain characteristics for addiction. They say it is A, B, C, D, E. A stands for abstain. These people with addiction, they cannot abstain from their addiction. They have difficulty quitting. And not just this, they also develop tolerance. Tolerance means if they start injecting heroin today, in 6 months, they start injecting heroin, like 1 gram of heroin today. In 6 months, it will be 2 grams. And maybe in a year, it will be 3 grams of heroin. So there is tolerance. Also, there is impairment in behavior, which is B. B stands on behavior. So people who have addiction, they have a problem with their behavior. You will find lots of impairment in their behavior, including like problems at work, problems at school, the poor work performance, absence at work. You will find legal problems, social problem, interpersonal problem. They use in a situation that is physically dangerous. They spend so much time on using the drugs or doing this addictive behavior. The third one, or the C, is craving. They have this strong desire to use drugs. Okay, the same if I keep you thirsty for 3 days or hungry for 3 days, you will have a strong craving toward food and water. The same thing, when you get addicted to something, you will develop this strong psychological desire or urge. A, B, C, D. D stand for diminished recognition of problems. What I mean diminished recognition of problem, when they have a problem because of the addiction, they cannot tell that the addiction causing me problems. So people can get stomach ulcer because of alcohol, and they don't make this connection between the alcohol and the stomach ulcer. People can get legal problems because of addiction, but they cannot see what's the connection between the legal problems and the addiction, or relationship or divorce, and they cannot tell that the addiction is causing me going through this divorce now. Also, people with addictions, they have emotional dysregulation. And when I say emotional dysregulation, I mean they have a problem in regulating their emotions. So when they get angry, they can't control it. For example, if someone offends you at work and you get angry and you react to it, you may be angry for half an hour or maybe an hour. For people with addiction, when they get angry, maybe they're gonna get angry for 1 day or 2 days, or maybe a month, and they keep thinking about it, they keep ruminating about it, and we call this emotional dysregulation. Also, people who have addictions, they have a problem connecting with their feeling, and they have a problem communicating their feeling. And as I told you, addiction starts with a feeling problem. They have chronic dissatisfaction or chronic discontent or chronic unhappiness. So the problem is not using a drug or doing certain behavior repetitively. The problem is what they feel inside and how they choose to cope with it. If you cope with this feeling in an unhealthy way, this is gonna end up with addiction. Again, American Society of Addiction Medicine, they believe in their definition that addiction is a progressive disease. Means if you don't get treatment for it, it's gonna get worse and worse and worse. And also, if it gets worse, it can lead to disability, it can lead to premature death. But I'm not saying there is no treatment. No, there is treatment, and usually the treatment include biopsychosocial, spiritual parts or aspect of treatment. You need to be working in the biological part, the psychological part, the spiritual part, and the social part. If you believe from listening to this video, if you believe you have some of these characteristics, the A, B, C, D, E, again, A, inability to abstain, B, impairment in behavior control, C, there is a strong craving, C stands for craving, D, diminish in recognition of the problems that resulted already, that was caused by the addiction. E, emotional dysregulation. If you believe you have some of these symptoms or some of these characteristics, please seek help. Thank you.